DW Africa Link.
Mental health is an invisible crisis, and in Malawi, it's reaching a tipping point. With a surge in depression, anxiety, and suicide, the country is facing deep-seated stigma, underfunded health services, and the critical need for systemic change. In this episode, we uncover the personal stories behind the headlines, the societal pressures driving the crisis, and the essential role of community engagement in shaping a future where mental health is treated with the agency it deserves. This community engagement gives us hope for a better future. Across the African region, more than 116 million people were already estimated to be living with mental health conditions pre-pandemic, which can be explained by mental health conditions being considered taboo and sometimes linked to superstitious practices such as witchcraft. People with mental health conditions are often facing discrimination and deprivation of their fundamental rights. Stay tuned. My name is Josey Mahachi. Welcome to Africa Link, the podcast that connects you to the stories that matter from Africa.
Africa Link, every weekday here on DW.
Statistics are projecting increased cases of mental health problems, including suicide in Malawi. Government records indicate that close to 2,000 suicide cases have been reported since 2019. On the contrary, a grouping of some mental health advocates under the banner Sorry, I'm Not Sorry, a group that aims to challenge the stigma and misconceptions surrounding mental health, say that the number is a misrepresentation of the actual situation on the ground, as over 4,000 lives have been lost to suicide during this period only. The Sorry, I'm Not Sorry group, led by passionate individuals like Joseph Sukali, who is actively working to change the narrative around mental health in Malawi, is joining me for this conversation to understand the leading causes of this crisis, as well as DW's correspondent Chimwemwe Padatha. We'll start with you, Chimwemwe. You are one of the correspondents on ground in Malawi. Tell us what exactly is happening. What's the situation like?
All right. Thank you so much, Josey. Yes, there is this worrying trend in Malawi, the increasing numbers of suicide cases. And what is more worrying about this whole issue are that young people are the ones who are committing suicide or attempting to commit suicide. And what prompted me to come up with this topic is this worrying trend, as well as a sad and traumatizing experience that I came across when I was working in one of the areas in the outskirts of Malawi's capital, Lilongwe. And during this fieldwork, I stumbled into a suicide attempt incident involving a certain young man. And this young man tried to kill himself by hanging. And fortunately enough, he was rescued by his relatives. The day after this incident, when he got back from the hospital where he was admitted, I went back to this village to check on this young man. The bruises that he suffered around his neck were very traumatizing. And I tried to inquire why he attempted to kill himself. But what he could say was that he doesn't know anything and what caused this suicide attempt. And this is very concerning, the fact that he is a young man. And after this incident, he never went through any mental health assessment. And this suicide attempt was kept as a secret between the hospital authorities, where this young man was rushed to, and his relatives, because at the moment here in Malawi, attempting suicide is illegal under Section 229 of the Penal Code, an offense which attracts a maximum prison sentence of about 2 years. And I believe that the matter was kept under wraps due to this reason. And this only portrays a glaring picture of such cases in most parts of the country. But sadly, many of these cases go unreported.
Right. But when we use the word trend, it means that it's something that is ongoing, Chimwemwe. Just to find out from you, what are some of the reasons that have really triggered this trend to be happening in the country?
Hearing from some of mental health advocates are attributing this worrying trend to the high unemployment rate in Malawi, the economic challenges that young people are facing, and the skyrocketing of prices. You see that people, mainly these youths, are failing to cope with these challenges. Issues of poverty, hunger issues in remote areas, and many are resorting to taking away their own lives. I could attribute this trend to these challenges here in Malawi.
Right. Now, Joseph, sorry, not sorry. That is the banner that you and your other fellow colleagues are going under, advocating and speaking against the rise in mental health problems in Malawi, precisely suicide cases. What is your concern?
Thank you very much, Joseph. My biggest concern is the understanding of what is bringing this incident to a level where it's now a trend. A lot of us have seen that economic hardship is one of the most attributed issue, but the whole issue has multi-layered causes. And as a country, we have not been able to dig deeper and unearth these causes. So while economic hardship is one of them, there are issues to do with relationships and family problems, and there are issues to come with cultural and gender pressures. The cultural norms in Malawi often expecting men to suppress their emotions, expecting them to be breadwinners. So it goes in different layers, and now it just comes as a wrecking ball, where now we are only seeing the results. And oftentimes we are only going saying it's the economic hardship, when in real sense it's a lot of things happening, and the lack of understanding of that suicide is a public health issue, not a legal issue where we are criminalizing attempts. I think that is also highly contributing to reaching the extent that we are in right now.
Right. But what have you established from your findings so far, Joseph, when it comes to suicide cases? Because honestly, suicide is something very deep, right? It's not a light thing. This is like someone killing themselves, like taking their lives, like this is the end. Problems are there, but there's always other ways to find solutions. But just also looking at the figures given out by the government in Malawi.
Yeah. Now, I think where we are stuck is the point when people don't understand that we need to start from a prevention perspective rather than coming to the addressing of the issue after it happens. So prevention is the best approach we can go for in this case. And you see that our country has not been able to invest properly when it comes to mental health. There is very little awareness of the issue. So there is a lot of awareness that needs to be done, a lot of investment when it comes to putting in structures, institutions that can help people, training practitioners that can help people. So with the current resources that the government allocates to mental health, I think we are going to suffer this predicament for a very long time. And if we don't act now, even the World Health Organization estimates that about 1,100 people will be dying every year in Malawi. So if at this point, for example, 2024, we were at 597, it means this year we should expect a larger number. And these are just reported cases.
Why do you say so? Why do you think this year we have a larger number, Joseph?
Because the understanding is not yet there, and the environment that has been created for our youth. Because if you have followed on the causes that are being attributed to, economic hardship is one of those. And looking at the current economy, We are in one of the worst periods, and we have issues of addiction, like betting addiction, and this is one of the main issues because from our Sorry I'm Not Sorry initiative, we have a psychological emergency support. We call it the venting room. So from the data that we have in the venting room, we have a very serious problem of betting addiction, and a lot of people are in debt because of this issue. And most of them reach a point whereby they're so desperate, and the only escape they think plausible is suicide. So I'm saying this because the current economic environment is not conducive, and worse still, there is no government institutionalized emergency support system. While efforts like ours, we are on a very small scale. We cannot attend to the population of the country on our own. So the government need to place a very vibrant emergency support system, because from what we have learned, people are willing to seek support, but they don't know where to get that support. So there is need for institutionalization of such initiatives.
Right, but as you are advocating and obviously ensuring that the few people that you're reaching out to at least fight against this worrying trend, Joseph, how's been the response so far, like from Malawians themselves?
No, I think, as I've said, people are willing to get support. And I will be honest, we have seen that people are ready to be supported, and people are ready to support others, because our movement focuses on establishing communities that are support systems to whoever is within their space. So if I have a family, it means I have to make myself the go-to person of any person that is around me. So we are thinking that
my confusion as to why I asked this when you said that people are ready, Joseph, is with what Chimwemwe just said, that there was an incident where the family are the ones that actually went ahead to hide this case, including the health practitioners, because it's an illegal thing in Malawi. The reason I feel the government is making it illegal is because obviously anything that is illegal means that someone has to go to prison, someone has to actually what is the right word? Yes, someone should be arrested for it, right? But then you see this covering up, and suicide is not something that anyone should play with or should joke around with. Then when you say people are ready, that's why I had to re-ask this again. How are they ready when they have to cover up when people attempting suicide and it's just swept under the carpet?
All right. So when I said they are ready, I meant the people that we have been able to reach out to. They are ready to get support. Not necessarily these are the people that attempted suicide, because that is something that needs to be advocated for strongly. And I think it's one of the things that the new Mental Health Act is trying to also address. They haven't been able to fully do away the criminalization, but with the Mental Health Act that has just recently passed, I am sure we are heading in the right direction, because different advocates and mental health professionals are trying their best to make sure that the government gets to understand that it's no longer colonial era whereby this law was applicable. We need to move from that practice, whereby now people need to be able to understand that this is just a public health issue, because mental health and suicide are in that family, but suicide and a crime doesn't make sense, because the layers that push a person to reach suicide should not be criminalized.
Now, Chimwemwe, speaking of advocacy and awareness, do you as a journalist feel like journalists in Malawi are doing enough to bring awareness against this worrying trend?
I would say that mental health advocates are leaving no stone unturned to tame this rising trend of suicide cases and other problems that come as a result of a mental health crisis. But I would also talk about the numbers. We have just seen statistics from the Malawi Police Service showing that in the first 3 months of this year, 2025, a number of 153 people have already committed suicide. And these statistics have skyrocketed from those of the previous year of 2024. So you can look at the 153 people killing themselves within 3 months. That's a very sad situation. And taking a close look on these statistics, you see that men are dominating the numbers. Um, Reasons that can also be shared by the advocate, which has just joined us, Joseph. And I can also talk about the projections by mental health advocates like Joseph himself from the Sorry, I'm Not Sorry. They have recently projected that 4,000 people have committed suicide in Malawi from 2019, while the statistics from the government say that 1,984 people have committed suicide. And I would say that there is a lot that needs to be done by these advocates and mental health professionals, talking about issues to do with awareness campaigns. And some institutions are now setting up toll-free numbers to allow Malawians to seek mental health care. I would say they have tried their best, but there is still a lot that can be done.
Right. But when we're talking about health advocates here, we are talking about also hospitals, doctors, psychologists, psychotherapists. I mean, the list is endless. How are they advocating and responding to this challenge, Chimwemwe? Do you feel like they're doing enough?
I still feel that there is an area which is lacking, which is the establishment of structures in the remote parts of the country, which are also registering high cases of suicide here in Malawi. I would suggest that these structures would be within the villages composed of custodians of culture. We talk of the chiefs, the villagers themselves, not leaving out the youth who have also been affected by this crisis. Apart from that, I also feel that we need to bring policies to guard against the illicit sale of drugs and alcohol here in Malawi, which has become a hot business in most localities. If we are to find out, many of these young people who are taking their own lives are either doing drugs or are into alcohol abuse. So we need to act decisively as a nation on this if we are to tame this growing trend.
Right. Joseph, your comment on this, that most of the youths who are actually committing suicide are doing drugs. Is it also the same finding you've seen, and what can be done then? And has government said anything or responded to this worrying trend?
Thank you very much. I would agree with Chimwemwe because as a community, as society, we have normalized numbing the pain, and most of the young people who are going through different phases of life they cannot handle properly, their escape is normally alcohol. So I would agree that most of the victims, even as reported by the Malawi police, it's clearly showing that drug and substance abuse and alcohol abuse is also one of the major causes. So, as I said, there are different layers that when they're just piled up, they create a bomb. So, yes, alcohol has been a very, very big contributor to the suicide cases. And for the government, I honestly feel like there is so much that can be done, but overall, there haven't been policies that control alcohol sale, especially even to younger people. We still have young people accessing alcohol anyhow, yet we have been able to protect, let's say, young girls from getting defiled or getting sexually abused. We were supposed to be as vehement as possible in terms of protecting who accesses alcohol and who doesn't. So young people have alcohol available all the time, everywhere. Selling places don't have the controlling mechanisms. So it's a real huge contributor. So I 100% agree with Chimwemwe on that one.
Right. But this problem Joseph, is not just affecting Malawi. This is a challenge that is affecting also many African countries, even the neighboring region. Then how best can countries respond to it? Is it an issue to do with policy, a lack of public mental health, funding? What exactly do you foresee as the problem?
I feel like we need to start with the government taking the issue seriously. The moment they do that, and then we'll get down to our policy, in the sense that from the policy, we need to start from awareness and then providing support systems. Malawi has a very beautiful public health system whereby every community in every traditional authority has a clinic, but those clinics do not have a section that can focus on mental health. But if we just use the same system and then just deploy mental health experts in those areas, we'll be able to cover a very wide area. So we need to work on the policy, work on the funding, because we know funding is even very bad because we get 0.01% of the health budget. That's what is allocated to the Department of Non-Communicable Diseases, the mental health department. So that's very pathetic considering how devastating mental health is right now. So there is need to rework on those numbers. There is need to train as many mental health experts as possible, because as a country, we only have 4 clinical psychologists. So it's pathetic. We need more.
Right. Chimwemwe, is there anything you want to add also in terms of reporting in the region? What lessons Malawi as a country can also learn from other countries?
Yes, I think that countries in Africa should realize that mental health is a basic human right, because most African governments do not invest in mental health care. So to say that we need proper investment, because low investment is one of the major hurdles to the prevention and care of mental health services. This challenge is leaving many people with untreated mental disorders. As a result, people resort to either traditional leaders or religious leaders for treatment in Malawi. And another thing contributing to this challenge is a culture of secrecy and stigma around mental health. We rarely talk about mental health in our homes and communities because of this culture of secrecy, and this stops people from coming out in the open when mental health.
Do you see government maybe reviewing the law or doing something about this towards tackling such issues as we wrap up our discussion, Chimwemwe?
Yes, the Malawi Parliament recently passed a reviewed mental health bill, which seeks to repeal and replace the Mental Health Treatment Act of 1948. And if this bill will be assented to by the president to now become a law, Malawi will see a change. There is hope that Malawi will see a change from the medical-based approach to treatment of persons with mental health conditions to a human rights-based approach to management, treatment, and the rehabilitation of persons with such conditions. So I would say that we are on the right track as a nation. We are hoping that the bill will be assented to by the state president.
Now, Joseph, as we wrap up our discussion, any advice to people who are having mental health issues, and also some Malawians who feel like suicide is the last hope, as you are advocating under this banner, Sorry, I'm Not Sorry?
My simple advice would be that it's high time we realize that, especially to the men, we are only human. As humans, we have the right to experience different emotions, and it's only right that we express them. And as humans, we are social beings. We are supposed to live in a community. There is no need to isolate ourselves, and it's important that we learn to seek help.
Joseph Sukali from the Sorry, I'm Not Sorry group and DW's correspondent Chimwemwe Padatha, thank you so much for joining us. At the Africa Link podcast, we always look across the continent to see how the stories we are dealing with play out or at times even overlap. One of the flagship interventions of the African Center for Disease Control CDC strategy on mental health is the integration of mental health and psychosocial support. The strategy, led by the African Center for Disease Control CDC, has a component in addressing suicide and self-harm in humanitarian settings. In Africa, many mental health conditions have received too little attention and concern from the general public and the healthcare system. That's it for this edition of Africa Link. Remember, you are not just a listener, but a crucial part of our community, and your participation can shape the direction of our discussions. We value your perspectives and encourage you to share your thoughts with us. You can find all of the Africa Link podcast episodes on Spotify and Apple, or wherever you listen to your podcast. This episode was co-produced and edited by Isaac Mugabi. My name is Josey Mahachi. Thanks for tuning in. Until the next one, it's bye for now.